Hello, it's King Tut, Kiss FM, and today we are talking about the importance of men's health as we celebrate Brovember. Today we'll be joined by Reggie Baker of Praise 104.7 and Bob Black from ESPN Radio. And together we'll navigate through this conversation along with our experts, who I will introduce in a minute. Throughout the month of November, Radio 1, along with our local sponsors, has been providing resources to information pertaining to men's health. So guys, we know that we may not always go to the doctor when we should, or go and get things checked until something is wrong or there's a problem. And that is one of the things we'll be talking about today. We will also be talking about men's mental wellness. During this past year, especially, everyone has been going through a lot. So we will talk about that. And last but not least, we'll be talking about what you need to do to look good going into 2021. Because you know, when you look good, you feel good. Throughout this broadcast, you'll have a chance to text BRO, B-R-O, to 23845. That's BRO, B-R-O, to 23845 for your chance to win a $100 gift certificate to Black Optics Tint or a $50 gift certificate to Cuts for Guys. Remember, text BRO, B-R-O, to 23845. First off, we have Dr. Matt Macy with Virginia Urology.
Thanks for having me. I just want to say I really appreciate it personally, and on behalf of our practice, we appreciate it as well.
Welcome to the show. Dr. Macy grew up in Richmond and attended the University of Virginia, where he double majored in biochemistry and music. He was worked on gene therapy research at Cornell University and received a master's degree in microbiology and immunology at VCU. He currently focuses on many areas of urology, including robotics, renal masses, upper urinary tract reconstruction, men's health, and general urology. Next up, we have Khalid Matin from VCU Massey Cancer Center. Welcome to the show.
Hi, Todd. Thanks for having me on, and I really appreciate you having this event.
You are the interim chair of the Division of Hematology, Oncology, and Palliative Care at VCU's Massey Cancer Center. Also the professor of internal medicine at the VCU School of Medicine. You are a board-certified medical oncologist and clinical researcher who specializes in the study and treatment of gastrointestinal cancers. Welcome to the show. And next, we have Randy Wilson.
Thanks, Todd, for having me.
Welcome to the show. Randy Wilson has professionally served in executive leadership roles in the mental health industry for nearly 20 years. Randy holds a master's degree in clinical psychology, is a former college athlete, and has been actively involved in the arts community since being a youth. He is the host of the Randy Wilson podcast, where he leads people through dialogue about real life things through the examples of people's real life experiences. And last but not least, we have Tammy Record. Welcome to the show.
Hi, Tat. Thanks for having us.
Thank you for joining. You are the founder, district manager of stylist at Cuts for Guys. She has been a licensed hairstylist for 20 years and has experience at 2 national hair salons. Tammy has been licensed for 20 years. Wow. At Cuts for Guys, they believe their clients deserve a quality, quick haircut in a clean salon. They value their stylists and work with them to advance their careers. Now, before jumping into our conversation today, we would like to thank our Brovember sponsors, Virginia Urology, VCU Health, Black Optics Tint, Cuts for Guys, attorney Stephen L. Washington, and the Randy Wilson podcast. Thank you all for making this conversation possible. First off, we're going to start this conversation with Dr. Macy with Virginia Urology. Welcome, Dr. Macy.
Thank you, sir.
So today, you and I are going to be talking about something that a lot of guys don't want to talk about, but I know that you can walk us through this and help us out. So let's get right to it. Help us understand, what is prostate cancer?
Sure thing. So before we even get to there, let me just maybe give you a brief synopsis of what the prostate actually is. I mean, that's a gland that we use for reproduction. And I kind of equate it as a donut that sits around the tube that we pee out of, which is the donut hole. So it's all intertwined and connected. And just like any other organ in the body, prostate cancer implies that some of the cells or parts of the prostate are kind of abnormally proliferating or growing to the point where it's not normal and can, worst case scenario, spread to other parts of the body.
And I got to say, I've had my experience, with worrying about that. I mean, I've had to get tested for prostate and found that my PSA levels were up. So And that could be a true sign of it. So what are some more symptoms of prostate cancer?
Sure. Yeah. I mean, you bring up a really good point. I mean, what the recommendations are PSA checks, which is simple blood work. Now, symptoms of prostate cancer can be across the board. I would argue that when we catch it early enough, the vast majority of symptoms are actually no symptoms at all.
Wow.
When you're having severe symptoms like bone pain or weight loss, we've unfortunately kind of maybe missed the mark and waited a little bit too long. And the other thing that can be somewhat anxiety, or that it produces a lot of anxiety for men, is that prostate cancer can occasionally produce symptoms that benign issues can also produce, meaning just a benign growth of the prostate. And that's urinary symptoms like frequently running to the bathroom, waking up at night to urinate, having a lot of urgency to go, things like that. The overwhelming majority, when we catch it early, are no symptoms related to prostate cancer itself, though.
Wow. So in your opinion, who should get checked for prostate cancer?
Yeah, I mean, I'm a big stickler for the guidelines, and the ones that we use suggest that essentially any man age 55 to 69 should get checked. And that's like I said, a blood draw to check the PSA, which is a protein that just the prostate makes. Now, that's tricky too. Not all things that cause an elevated PSA mean that prostate cancer is there. So we got to look into it. With the combination typically of things that guys typically don't want, which is a rectal exam to feel the prostate. Now, there are other men that we recommend screening at an earlier age, anywhere as early as age 40.
Now, you bring that up about that exam. Now, I'm a stickler for health, for my family, and for myself. And I had that exam and everything checked out wonderfully. And I'm telling you, most people are scared to get that exam. I don't even remember what happened. And, once they set you there and give you what you give you, next thing you know, you'll wake you up and, hey, you're all done. And they show you your images. Now, when I found out I had a high PSA level, that's when things got bad and I had to get a biopsy. Now, that is what we don't want to happen to people. And I just need to understand, and maybe you can help me, why are so many men so hesitant to get checked out and do what I did? Just go do it.
Yeah, I think it's a multitude of reasons. Maybe just an overall lack of knowledge, and that's why these events that you guys are putting on for us are so helpful. And then there's probably some form of stigma related to it that I think is, in the grand scheme of things, really just driven from personal reasons for most men. Don't want to talk about it, don't want to talk about sexual function, nervous about getting a rectal exam, would rather not know about it, things like that. So, I mean, I think it's a ton of different reasons that cause people to be a little hesitant to get checked. But I do very much encourage guys to be proactive, like you're saying, and just try to, it's a quick visit. Your primary care physician can do it. We'd love to see it at Virginia Urology. We definitely recommend it.
Now, in our community, the African-American community, there's always that fear of going to the doctor. I'm just too tough for that. I'm not going to do it. But we have to let people know why it's so important for African-American men to get checked.
Yeah, for sure. I mean, I think, again, if strictly going by the guidelines, anybody age 55 to 69 should do it. But the truth of the matter is, and this is just the unfortunate part of genetics in our world, I would argue, and most of the statistics in the United States, at least, would say that any man across the board has about a 1 in 9 chance of being diagnosed with prostate cancer. If you have a first-degree relative, it drops it or increases that is to 1 in 5. But African-American men, with or without relatives, just the race alone increases the risk from 1 in 9 to 1 in 6, excuse me. So that I think is within itself a reason for, or why it's so important for African Americans to get checked, excuse me. And I mean, and you could make the argument, some of the guidelines say as early as age 40 to 45 for African American men because of that reason.
And I believe me, I've read about it, and my wife's a nurse, and she told me, no, go get checked. Sometimes we need that little kick and that nudge.
That's right.
My thing is, now that you're talking about how important it is for African American men to get checked, is there a lower age that we should start, and how often should we get checked?
Yeah, I think that is an intricate question. So certainly if I'm seeing an African American man in the clinic and he's 41 and it's for other reasons, I don't, force people to get a PSA, but you could at least have the conversation. And I try to, another 30 seconds in the clinic visit just to say, hey, this is something to think about. I'd be happy to do it. This is why we do it. So again, people that have first degree relatives or African American men, and then there's some other, morbid obesity, smokers they have a little bit of a higher risk of prostate cancer. You can make the argument for them in that age 55 to 69 range, really no matter the race or any other factors, we recommend usually an annual exam and check for those folks. Now, if I think this is based on personal preference, patient preference, a shared decision-making between the physician and the patient, where like if you come in and you're 42 and your PSA is really low or your rectal exam is normal, can you wait 2 years or even longer? Yeah, probably. I mean, I don't know if you need to do annual exams at that age, but so, it kind of is patient dependent, but we certainly recommend it though.
Is there something that men do, in the African American community that would make our PSA be high? Because, mine was at 6, which is really high. But with getting a biopsy, there was nothing found. They said I was perfectly healthy. I just had a high PSA. Maybe it was vitamins I was taking, maybe supplements.
Yeah, no, that's a great question. I mean, and that's a really tough question too, because a lot of the patients that I see in the clinic are there as a new patient for elevated PSA. And I really try to give people some reassurance up front. There are times where I'm like, okay, we need to do a biopsy, like you said, but not all things that are elevated PSA are prostate cancer. So people can have benign growth. Men can have benign growth of the prostate. That's super common with age. And that within itself can cause the PSA to be elevated. And then there's a ton of other reasons. If you have sex the morning that you get your blood draw done, if you have a rectal exam, if you've had a recent procedure for a kidney stone, or you have infection of the urine or inflammation or infection of the prostate, all these things can cause the PSA to be elevated. So it's not perfect. And that's why we have to kind of tease some things out.
Right.
I wouldn't say that. No, I don't think any within the African American community are those folks doing anything in particular besides the genetics. No, I don't think so.
Perfect. Now, if someone gets diagnosed with prostate cancer, what is the likely outcome?
Yeah, I mean, nobody wants to be diagnosed with cancer anytime. That's the truth of the matter. It's always a sobering conversation in the clinic. And I try to tell guys that, look, nobody wants a diagnosis of cancer. But as a man, if you had to choose one, prostate cancer is probably a pretty good one to choose. And the reason I say that is because it's not a death sentence. There are ways to treat it. And I would argue that the majority of the time, those ways are meant to be curative, meaning we're not trying to keep it at bay for the large majority of patients. We're trying to actually remove this from the body or treat it completely so that it doesn't come back. And there are really good outcomes for patients with prostate cancer. The overwhelming majority of guys are still alive 10, 15, 20 years down the road after treatment and diagnosis.
Wonderful. That's great news to hear for those that are listening and looking right now, and they're a little nervous about that. Dr. Macy of Virginia Urology, I want to thank you so much for your time today and all of this important information. And guys, if you're watching, the takeaway is get checked. I got checked. You can get checked. I was a little nervous. Yeah, I was scared just like you, but I got checked and it worked out. So I need you to get checked. Please Once again, Dr. Macy, thank you for your time.
Todd, thanks so much. I agree. Get checked, guys.
Good check. And now joining the show, Dr. Mateen. He's with VCU Macy Cancer Center. And today, I want to ask you about what else men should be doing to be proactive about their health.
So one of the, I think, main issues currently is that we're seeing a rising incidence of young individuals, young men as well, getting colorectal cancer. And I think there's been really documented literature showing that the average age of getting diagnosed and the number of people diagnosed below the age of 50 is going up by about 2 to 3% every year.
Wow.
Which is actually quite, concerning and alarming. And I think there's been a lot of concern that it may have to do with certain dietary and other lifestyle factors, changes that are happening, basically that have happened over the last couple of decades.
Now, we've talked about prostate cancer, but what other cancers are out there that men need to be proactive about?
So just like with prostate, with colorectal cancer too, there's very effective screening. Now, the important thing to realize about screening is that screening really means you have a test that is recommended by guidelines when you don't have any problems. So basically, it shouldn't be that, oh, I'm fine, I don't have any problems, my stool is fine, I don't need to get screening. That's not the correct way to look at it, because screening is done based on the premise that there's something that potentially could be going on inside that we cannot detect, and there's no symptoms yet, there's no problem, there's no pain, there's no blood, but the guidelines suggest that we need to get screening done starting at a particular age and at the recommended intervals. So I would say for men, it's equally important to make sure that they get screening for colorectal cancer, because it is very easily preventable. And also, if it is diagnosed, it can be diagnosed much earlier and therefore give you a much higher chance of being cured of your cancer.
Can you talk about anything else specific to African-American men that we need to know?
So unfortunately, in African-American men, we do see a lower average age of colorectal cancer. And that's why even though just recently the American Cancer Society came out with the new guidelines of lowering the age for everyone to start colon cancer screening from 50 to 45, for African-American men, it was already at 45 for about the last 10 years, because we already have a good amount of data showing that African-American men unfortunately tend to get diagnosed with colorectal cancer at a younger age than other ethnicities.
Now, are there other things that men can do to stay healthy and decrease their risk of certain cancers?
Mm-hmm. So apart from screening, of course, which, as I mentioned, is important because that can prevent cancer. Because just to bring up, you can basically find and remove polyps before they become cancer. So you're actually, in a way, removing an area of abnormality in the colon or rectum before it can become cancer a few years down the road. Number two, diet. There has been concern over the last few years that processed foods, especially processed meats, are basically carcinogenic, can promote cancer. Red meats are also carcinogenic. So reducing the intake of processed meats and red meats, and definitely a lot of benefit to exercising regularly and maintaining a good healthy weight, not being overweight. So all of these things are, I think a lot of these lifestyle factors are interrelated, and all of these are important in terms of lowering your risk of having colorectal cancer.
And in the African American community, we love to grill. We got our ribs, we got all kinds of red meat, and we eat it like crazy. Some people don't eat pork though, so that's the thing. Now, doctor, you specialize in gastrointestinal cancer. So can you tell us more about how that affects men?
Yeah, so it affects men just like it affects women too. But as I mentioned, especially when it comes to colorectal cancer, I do see that unfortunately there's lower rates of screening in men than there is women. So I think men in general need to own that more, because ultimately it's a matter of health for them for the long run, and preventing cancer. So I think it's just like other cancers that are specific to men. you are actually more likely to die of colon cancer than you are potentially a prostate cancer, some more deadly cancer. So all the more reason to be screened for a cancer that is very deadly, and it's preventable and potentially curable if diagnosed early.
That is the key right there. It's preventable and it's curable. You have to get checked. Dr. Mateen of VCU Massey Cancer Center, I want to thank you for sharing your time and your information. Hopefully, all of those people who are listening right now, men, take this information, absorb it, and get checked. Let's do something about it. Thank you, sir, for joining the show.
You're welcome. Thank you.
And I want to remind y'all, text BRO, B-R-O, to 23845. That's BRO, B-R-O, to 23845 for your chance to win a $100 gift certificate to Black Optics Tent or a $50 gift certificate to Cuts for Guys. Yeah, remember, text BRO, B-R-O, to 23845. And now I'm going to turn it over to Reggie Baker of 104.7 Praise FM and Randy Wilson as they talk about how we as men can get our minds right.
Thank you so much, Tut, and welcome, Randy. Randy Wilson is with us today from the Randy Wilson Podcast. Randy, we need some inspiration. You got to inspire us. It's been a crazy year so far. 2020 has been showing off from social unrest to COVID. And research tells us that men specifically don't always take the time to assess their own mental health. And it's important for us to make sure we're helping ourselves for sure. Now, where do men start when it comes to assessing their mental health?
Reggie, I believe it starts with men looking at their basic needs, such as the quality of how they're eating, their nutritional health, they get adequate sleep and rest at night, the quality of how they're working and or performing in their job and managing their business and managing their relationships. They're all really critical. Are you getting along with your friends and your family? I think it's important that our overall general outlook on life is appropriate. Do we have cultural and spiritual support systems in place? What is our belief in how we see the world, and how does the world see us? So just a few things there I think that are important when men are assessing their mental health.
Okay, great. And so what are some things we can do on our own if we're having a tough time?
Well, it's going to be different for all of us. Life requires balance, and the thing or areas in our life that is causing difficulty for us to probably just requires on us either slowing down, relaxing, taking a deep breath, reminding yourself that you have the ability to manage and control your feelings. Remember that positive thoughts often contribute to positive feelings, which result in positive behavior. So just as well as the opposite, if you're having a tough time, you got to get to the foundation of what's going on in both your head and spirit. Unplug from social media. Put your phone away. Maybe pick up a book, exercise, pray. Find a place free of distractions so that you can better manage and balance in your life.
Wow, good stuff. And pulling away from social media is really big in a time like this. Now, let's talk about stress, because managing stress correctly can really make a big difference.
Yeah, managing stress is critical because we all have it, but we all wear it differently. Failure to manage it well can lead to other more serious health issues, such as the doctor spoke to earlier today. So I encourage people to be very mindful of the individuals in their life that they surround themselves with. And remember, perception is everything in regard to how you see the world. The constant absorbance of everything right now that's happening in the world sometimes requires a balance and you just turning things off. So stress is a very difficult thing.
Yeah. And being a guy, like, why do you think men, and we're all guilty of this, why do you think men are hesitant to talk to a professional if they need help?
One of the best things we can do as both men and women, I believe it starts in how we raise and bring up young boys. If we teach them that it's okay to have feelings, and when we groom up young boys in a way that they can understand that having feelings is healthy and there's appropriate ways to express those feelings, then our young boys will grow up more comfortable and confident in identifying when they need to outsource themselves for additional help. So I believe that it starts before men are men. I think it starts with how we raise our young children.
Great points. And again, like with everything going on this year, what tips can you give to keep men positive as they're helping themselves and taking care of their families?
Well, we're definitely being tested right now. It's requiring us to try and do things differently. We are experiencing life right now unlike any other way that we've ever experienced it. So keeping that in mind, we need to be realistic with what our expectations of ourselves. If you do have a belief system, I encourage you to tap into it. If you don't, I encourage you to use the support system around you in your life, because everyone right now needs support.
Awesome. Great information, Randy. Thank you again, Randy, for your time today. We really appreciate it. And now I want to welcome in Bob Black from ESPN as he's going to wrap up our conversation today with Tammy Record from Cuts for Guys. Hey, Bob.
Reggie, how you doing? Good to see you, my friend. Glad to see everyone out there. I would like to introduce our next guest from Cuts for Guys, Tammy Record. And I would make the argument, Tammy, at the beginning of the show, somebody, I think it was Tut, said we were going to save the best for last, which is you. But I would also say we're going to save the most fun for last.
I'd say lighter topic,
even a guy
for
like
sure.
me, Tammy, even a guy like me, Tammy, goes and gets his hair cut and has an enjoyable, relaxing time doing it. As the guys were just talking a moment ago, you got to have some time for yourselves. And Tammy, I'm sure you can tell our guys out there, going to get your hair cut is a relaxing, nice thing for guys to do for themselves.
It really is, Bob. And I'm so grateful that you guys are having me on today.
Hey, so I mentioned, I'm a little bit challenged up here, but I still go and I get my hair cut and I relax and I enjoy it. I want to look good. So what are the trends right now that you're seeing out there for guys?
The trends right now are all over the place. A lot of guys had an opportunity to grow their hair out over COVID, and some of their ladies like it. So we've had still guys come in and want all the hair cut off. Short is very popular, but a lot of guys are letting their hair grow out now.
All right, you're looking at mine for the first time, full disclosure. But what, if anything, would you do with this? I mean, I got it in the back, I got it on the sides. I like it trimmed. I feel better when I walk out of there and it's shorter. Any other suggestions for someone like
I would
me?
go with short too.
I'm coming to see you then, because I like that. I like that a lot. All right, as you mentioned, we've been cooped up, the whole COVID thing, and we have seen probably more beards and goatees than we've seen in a long, long time. How stylish has that been? Is it something that's in with guys right now?
Beards are very popular. They were popular before even COVID shut us down, and I feel like they're even more popular now because people have to wear masks now, so they don't care how the facial hair looks, and I think ladies like beards. So we're doing a lot. The governor has just now allowed us to do beard trims. So you can come on in and get your beard all fixed up, and we can show you how best to keep it. And I recommend beard oils for all men. Just softens the beard and keeps some control in it.
Probably keeps them a little warmer in the wintertime now too with the cold. Right? All right.
Yeah.
So look, we have been cooped up, the whole COVID thing. We're getting out now. We certainly want our audience to go visit you and your folks at Cuts for Guys, but we do know that during this pandemic, a lot of guys are taking matters into their own hands. Any tips for those folks, for those guys, Tammy, if you got to do it yourself, or maybe you do have to have your lady take care of you, any tips before they can get to see you at Cuts for Guys?
I guess we've been doing a lot of fixing, and so a lot of COVID hair. So I can only just recommend you guys come in. We can fix you up, have your lady do whatever she can till you can make it into us.
That's really good advice. Stop doing it yourself. Find some time, wear the mask, social distance. I'll give you a second here to talk about your salons and how clean they are and how safe they are, so that we can encourage the guys not to take the scissors in their own hands, but to come see you. So give us a little background on, I know it's been challenging, all kidding aside, in all seriousness, how difficult this whole pandemic has been for you.
It's been rough on our industry, that's for sure. But I will tell you the good news. We've been open since May 15th. We've done 35,000 haircuts. We have 3 locations. We have 50 stylists, and not one stylist has gotten COVID. So we can keep you safe. We offer appointments if you're worried about coming in and waiting in the salon. You can do it online through our website, or you can call the salon and make an appointment. We use clean capes every time. We disinfect everything. We're a mask salon, so you do have to wear a mask, but we can keep you safe. I mean, you can come in, get your haircut, and like I said, 50 stylists, no COVID in 7 months. That says something.
That is absolutely awesome. Really, really well done, because we know it's been a challenge. And this is obviously a physical thing and an appearance thing, no doubt about it. But do you also sense that when guys walk out of there mentally, they're feeling better about themselves? Also, we just had that conversation with Reggie and Randy a couple of moments ago that mentally they feel better, you look good, you feel good.
Absolutely. And one thing our salon does that I think men really enjoy is we do straight edge neck shaves. So when you come in, you can get your hair cut, but we also can shave your neck. And we use a hot towel in the back of the neck and shaving cream. And it's just a nice experience. I have many men that come in and say, I just come in for the neck shave and really the hot towel. It does alleviate stress. It's amazing what that simple thing can do just to make you feel better and relax.
That's a big one for me. I'm not going to turn around and show you or our audience. I'll show you when I come in, but I've got that neck hair. So that straight edge shave and the hot towel, that is right up my alley. So if I was coming in, Tammy, tell us where we're coming. Tell us about your locations and any other information, website, any social media that our guys can follow you before they come in to get their haircut.
Well, we have 3 convenient locations. We're in Short Pump, right in the middle of Short Pump, right by the movie theater. We're in Midlothian at Westchester Commons, and then we're in Mechanicsville. Our newest location is Mechanicsville by the Tractor Supply and Harbor Freight. So we're easy to find, easy to get. We offer discounts for our police, fire, active military. We offer our senior discounts. So we've got everything going on. We're open 7 days a week. So even Sunday, shortened hours, of course. We offer lots of services. We do hair coloring for men if you want to feel a little younger, waxing. I guess that's it, but we have just a lot going on there. So come on in and see us. You can get more information at cutsforguys.com, and we're on Facebook and Instagram.
Looking forward to it, Tammy. Thanks so much for being with us today. I know we've had a lot of serious conversation and needed, but I'm glad we could wrap up with something a little fun and relaxing. Thank you, Tammy.
You're welcome. Thank you for having us.
All right, Tut, back to you. I'm going to get my hair cut at Cuts for Guys. What hair I have, my friend.
Yeah, me too. Hey, here's the deal. People, look, it's all about staying healthy, mentally, physically, spiritually. Here's the deal. I want to make sure I thank all of our panelists that came on today. Dr. Matt Macy with the Virginia Urology, Dr. Khalid Mateen with VCU Massey Cancer Center, Randy Wilson of the Randy Wilson Podcast, and of course, Tammy Rickett, the founder, district manager, and styles at Cuts for Guys. Thank you so much for joining the show. Thank you.
Thank you.
Thank you,
What
Thank you.
truly needed right now in this world, and continue to do what you do, and may you all be blessed and successful at what you do.
Likewise. Thanks for having me.
Thank you.
Also want to thank Reggie Baker, Praise 104.7, and Bob Black of ESPN Radio. And thank all of you, our listeners, for tuning in and supporting us through these trying times. We're going to tell you what's next, RVA. You just got to make sure you follow us on all our social media avenues, and definitely follow us on Facebook. And bottom line, stay healthy. It's important for you and your family. Peace to y'all.